welcome to Samasta TV. We are so excited today. Here in this show, we interview incredible people from all over the world that are experts at what they do, masters at what they do, and is all related as to how to take our healthcare system to the future. Today, we are so thrilled to have James Maskwell. He is the Functional Forum leader and founder, which is the world's largest integrative medicine community. He's on a mission to create a structure that is necessary to evolve humanity beyond chronic disease. He's a speaker internationally. He's been featured in TEDx, TEDMed, and HuffPost Live. He's also has found New Health, which is a payer solution for chronic disease reversal. And he's the author of Evolution of Medicine. We're so excited to have you here. James, how are you?
I'm awesome. Good to be with you. So happy to see Hawaii in the background. It looks beautiful out there. I got to come out there.
Awesome. For sure, man. You better come out here. And so, James, tell us a little bit about your backstory.
Yeah, so I was the weird kid at school that did natural medicine. I grew up mainly in England and South Africa. My parents were English and South African. I was born in America, but I had like a homeopath and a chiropractor, and that was just the healthcare that I had. And I thought that was totally normal until I got to school and realized that no one knew what a chiropractor was. That was not something that anyone had ever heard of. And, it always just stuck in the back of my mind. It's like, this is, it was strange. One of the things that always stuck with me is I was the only kid in school who the nurse would have to call my mother before they gave me antibiotics. Everyone else was just like, go get them. So, I always wondered to myself, like, how did my mom, with no medical training, predict antibiotic resistance by 30 years? And, that was sort of just something that was stuck in my brain. And, I sort of had a rebellious phase where I thought I needed to be an investment banker. And after about 6 months, I was just like, I'm playing for the wrong team. I'm out. And I moved to America and I started working in integrative medicine. And that was the beginning of the journey.
Wow, that is awesome. And when you set out, what was it that you wanted to accomplish?
Yeah, look, I just had a feeling. I didn't really know what I was doing. I was 24. I realized that I knew I wanted to be an entrepreneur. I knew I wanted to make my own thing. But I didn't know what that was. And I wanted to just learn about something that I was interested in. And I was really interested in health because my degree was in health economics. And I saw that, arguably the biggest problem in the world was chronic disease, right? It was going to bankrupt every nation with the costs. You had, in America, you had just sort of rapidly declining return on investment for every extra dollar that was going into the healthcare system. And a lot more dollars were going in than anywhere else in the world. And I just thought this is an interesting paradox. Like here's a system that's spending way more money, getting worse outcomes, infant mortality, life expectancy, starting not just to like level off, but actually starting to go down. And I just thought something about what I knew from growing up could be a solution to that, but I didn't really know what I was getting into. So I came across to really, I guess the phrase that I would use is like, seek first to understand and then to be understood. So for 7 years, I was like, I ran a clinic, I was a sales rep, I was working with doctors doing integrative and functional medicine, just really learning what the industry was about. And then in 2014, I at that point, I'd already been like a speaker at conferences about practice management. And, I decided that the conference game in functional medicine was, way outdated. And so we started our own conference that became the Functional Forum. And we did a few things on that no one had ever really done before. First, we live streamed it when live streaming was hard. Two, we only let people speak for 15 minutes, not like, hour or hour and a half lectures, no CME. People told us we would only get an audience if we gave CME credits with no CME. We had Daft Punk as the music. We just tried to do something different and make it, we tried to put cool, young, aspirational doctors on the stage and not the old guys that had come up with the original vision. We still have them every so often, but doctors like Kelly Brogan, Jeff Glad, Shilpa Saxena, these kind of people, we wanted to put doctors up on stage that other doctors would look at and say, I want to do that. I want to be that person. And that was sort of like the genesis of it. It spread really quickly. By the third or fourth episode, when the streaming finally worked properly, we had 5,000 doctors that watched the show. And that meant that it was already like 4 times bigger than any conference. And we were off to the races, and we haven't looked back since.
That is awesome, man. That is, you just got to congratulate you on that. That is a great, awesome job done. And when you started that, what was one of the big problems that you hit first, that you experienced? What was one of the walls that you hit?
So one of the things we saw was just, there's been a lot, obviously being an entrepreneur is like being punched in the face every day. And then, the only gratification is really to look a year back and see how far you've come. So there were a lot of problems. One, I had a job that I was meant to do. And this was just like a side thing. It was in the same space. So I had to like work out that, we worked out very quickly that, the most competitive part of, if you had the attention of doctors, the number one way to monetize that was to get, supplement companies to sponsor it. But we just sort of wanted to resist that because we wanted to really bring people together. And if we straight away, like almost at the beginning, we became affiliated with one supplement company. And I think actually in the end, that would have killed the whole thing. And what we did is we went supplement neutral. So we said, we're not going to take money from supplements. We're not going to take money from labs. We want to bring everyone together. And, I think part of that energy helped us to grow, but we certainly left a lot of money on the table. And, I didn't pay myself from that business for almost 2 years while we were getting things going. And I was sort of moonlighting with my other job to try and get it off the ground. With every business, there's always that at the beginning, but I was thankful to have built up, this other business before where I was sort of an independent contractor, and I had some, flexibility so that I could really spend my time focusing in on what I was there to do. So there were many challenges. Streaming was hard at the beginning. It was really costly to do streaming. When we moved up to doing it in HD, now we were running like a $20,000 a month event. That was really expensive to run, and we had to work a bunch of things out. But that's with being an entrepreneur at every level. There's always problems, and working out those problems is the game.
Absolutely, man. That's the name of the game. And when you were going through that, was there an epiphany or something, an insight that you got, while you were starting to going through all these problems? Any one of the biggest? I mean, I'm sure many, but one of the biggest ones.
I would say that the insight that I brought into the show, which the energy that we wanted to bring into the show, was that integrative and functional medicine has the winning hand. Mm-hmm. Right? We have the winning hand for chronic disease, but because of just the history of being like stamped down by the man, everyone's very fearful. Everyone's very, scared. Everyone doesn't feel like that. There's like this inferiority complex that's built into the whole industry. I don't think the young doctors have it so much, but the old guys have been around who maybe have been in front of their medical board for not doing standard of care medicine, just a lot of fear.
Yeah.
And so I came into it with like the first thing that I said on the first show is like, we don't start acting like we're winning, not like we're losing, because we've got the winning hand. Like, this is the solution for chronic disease. And I hope that energy sort of, it made it popular. And also, like, I think people were ready for someone to say that. I was just in a unique position, is that I didn't have a medical license to lose. Right. And so like I could say whatever I wanted. And I hope that in retrospect, we were able to bring confidence to an industry that desperately needed it.
That is awesome, man. You were in the perfect position to do what you're doing. And when you saw that, the insight that, hey, this is the way to deal with, this is actually the solution. What was your plan then? What type of plan did you create?
Well, the cool thing is that the plan emerged from the show. So like on the fourth episode of the show, 2 amazing things happened. One, Mark Hyman came and announced that the Cleveland Clinic was going to do this, functional medicine center, which was huge credibility for the whole movement. And he announced it on my show. No one else knew about it until it happened. So we're just like, holy shit, this is a place where you get the coolest insight. This is what's going on. But on that same episode, Dr. Jeffrey Glad, he really set out what we thought was a plan. Like, we can't really help Mark Hyman in that way. Like, go Mark, like do it. But we can't really execute on any help for that moment. But Jeff spoke about the micropractice revolution, which was essentially how to build the least possible overhead practice delivering integrative and functional medicine, so that all the doctors that would love to do it and felt a moral obligation to do it but had not worked out how to do it could make their journey across and could actually do it every day. And that was a huge piece, because then now we had a vision, right? Let's help doctors make the switch to functional medicine and help them with the practice management parts of that, look at the low overhead model and focus in on that. And then so then we could find sponsors that helped to support that. Then we could, like, I was the host, so in between the clinical speakers, I could espouse those ideas. I could give practical tools on things like internet marketing, scaled up patient education, you know, all the things that you need to run a successful practice, how to be efficient with your time, how to use health coaches with the doctors to, you know, to deliver care in the most efficient way. So that's, you know, those were all the things that came into it. So, you know, just by bringing smart people onto the stage and curating their voices, we were able to really, you know, to learn actually from what they said and to evolve the plan as we went along.
That must have been an exciting moment when when Dr. Mark Hyman was in your show and he announced that, dropped that in your show, huh?
It was amazing, dude. That was like the best forum. We went 40 minutes over. I didn't care. That was the first time the live stream happened. It was the only show to this date where we didn't do like a panel or anything. I just said, look, go get him. And as soon as he started talking, I was just sitting there. You see the big smile on my face. My partner and I were looking at it. I was like, oh my God. And everyone in the crowd is like, wow, Cleveland Clinic. And I'm like, yes, we're doing it. And the streaming's working.
That is outstanding, man. That's awesome. And when you started doing, and so now you have a plan, you had a plan of the micropractice, and now you had a tool for providers to really deploy all over the world, really, that they could use. And so what was one of the conflicts that you experienced now when you had this plan and all of you started doing this?
Yeah, so there, you know, it wasn't so much conflicts, but it was just, you know, how do we get there, right? How do we get to a point where we can actually help people to do this? So first of all, we went to find sponsors who could match that vision, right? The low overhead practice. So, you know, Full Script, for instance, is this platform where you don't have to have all the supplements in your office. You can just have them delivered to the patient directly, so it reduces the overhead. You know, Igbo, which was the Uber for phlebotomists, right? You don't have to have a phlebotomist in your practice. You could have a mobile phlebotomist go to the patient's home or office. You know, we would find things that that matched. I would say, you know, one of the things that was tricky along the way was just, how do you get doctors to actually do it, right? You know, if we're in the business of facilitating this transformation, it's one thing for me to tell people to do it from the stage. How do you actually get the word out? And then how do you create it? So that's kind of what led to the book. Is I was like, I'm going to write a book with a step-by-step guide. We're going to give the book away for free to everyone. We're going to make it as cheap as possible so that people read it and go, okay, here's a step-by-step guide. And then if I need help, you know, really implementing it, we started to build a business around facilitating that. So we got the book, and then we started this thing called the Practice Accelerator, which was basically just a community for these micropractice doctors, where they could come together, learn from us, learn from each other, and get confidence from being part of a pool of people that was actually trying to do the same thing. And so that accelerator, now we have like 500 or 600 doctors in it. You know, we've got this awesome online community where people are trying things, and we've had real, genuine innovation coming from that group, right? We've had people create new ways of onboarding patients into the practice, where there's a group structure, where, you know, there's peer-to-peer support. You know, the themes have been community, coaching, and content. Those have been the three themes that we've helped practitioners to think about adding to their practice, right? Add content, like, you know, put on workshops, put out content into the world that shows the kind of thing you want to do, like we're doing right now. Yeah. 2, you know, build a community, you know, so do your events in a community structure, like, you know, build a community, do community events, you know, that kind of stuff, do group visits and that kind of thing. And then coaching, add health coaches in. You know, if a health coach is 10 times less costly than a doctor per hour, you know, they should be doing the heavy lifting on the behavior change, which is the most important part of the functional medicine practice. doctors. So, those were the things that we learned. So, we kept on doing the show. We kept on building the communities of doctors, trying to make it easier for communities to grow and thrive. And then, it was really focused in on how to facilitate doctors to make the transition.
You nailed it. I mean, I was in the Institute of Integrated Nutrition, because as a physician, I didn't get any training on nutrition. So I went over there to learn it, and then that was the first time that I experienced or that I learned about health coaching. And I was like, oh my God, like this is like such a big, this is gonna be such a key factor and so I'm so excited that you guys, of course, this is such a big part because they know more about nutrition. They can spend that time with the patient. I mean, I completely align with what those three key factors. That's great, man. That's great.
Yeah, it's cool for you to do it, like for you to understand it, but ultimately for you as a physician to have scale, right? For you to be able to help thousands of people and not just like dozens of people. If one doctor could have 7 health coaches and, they're all doing their thing and you're overseeing it, and then, so we started focusing and sort of shining a light on doctors that were doing it right. Like Frank Littman had exactly that model. 1 doctor, 7 health coaches, thousands of patients. And so we just started to shade, like, look, this is how you could do it. This is what you should do. This is the structure. And so that was just an easy way for us to, to share the pricing model, all that stuff.
That's great, man. And so you guys really so they're already doing this with the health coachings and everything. And now that other doctors can see really, hey, this can be done. And so what type of, and now, so what other things have you achieved now with everything? I mean, you got the book and you've told us about the book, about laying out all the step-by-step, and tell us a little bit more about what you're working on and what you've achieved.
Yeah, so that business is called The Evolution of Medicine. If you're a doctor or a health practitioner, we can now help you go from where your practice is now to where you want the practice to go, the marketing, the systems, the automation, everything to build your own practice doing functional medicine. And that's really exciting. And very proud of what we've been able to do. But I'm not done yet. We haven't evolved mankind beyond chronic disease in any way, right? We've just got an army. The army of doctors is just slightly bigger, right?
Yeah.
So now it's about coordinating the efforts of that army to fulfill big contracts with thousands and thousands and thousands of people. So, at the end of 2016, I'd written the book, we'd started the accelerator, and I said to my partner, there's a new thing that we're going to start looking at, which is how do we get this to the masses, right? How do we get everything? And there's 2 major ways that most people in America get their health care. Employers, 151 million, and insurance, right? That's who pays for it.
Yeah.
And so we were like, okay, if we believe that we have a winning hand, and if we believe that in the medium term, these 2 groups are going to want functional medicine, how can we make it easy for them to say yes? Because one of the problems that we saw in the function, with this model of the small box revolution model, which is the micropractice model, everyone's using different technology. Everyone's pricing their thing differently. Some people are doing a monthly pricing. Some people are doing a one-off pricing, like all this kind of stuff. And we were like, look, can we create a vehicle that allows everyone to get paid well, that allows everyone to be happy, but ultimately allows us to facilitate large-scale contracts. So it's called New with a K, K-N-E-W, newhealth.com, and we're doing it. So, we tried it out last year. The first test that we wanted to test was, could we get people well using mainly health coaches and a little bit of doctors rather than mainly doctors and a little bit of health coaches? Woody Merrill, who ran the Continuum Center in New York, when he was interviewed at a conference I was at, saying because the Continuum Center shut down, right? It was kicked out. And he said, how would you do it differently if you could do it again? And he was like, if I could do it again, I would have mainly health coaches and just a few doctors rather than the other way around. So I was like, okay, this is interesting. That was kind of what my thesis was anyway. So we started doing it. And guess what? If you get people to eat properly, exercise, take care of their stress, have good community, relax, and exercise, all that stuff, people get better.
Yeah.
I need the doctor.
Yeah.
Right? And so it worked. So in November last year, we announced our initial data. We showed the transformations that we've been able to achieve. And straight away, the payers and the employers started showing up. So, you know, we partnered with this company called Benecomp. They've been providing insurance to employers and self-funded employers for 55 years. And their CEO had an incredible experience with functional medicine with Jeff Glad, who, you know, is now the chief medical officer of NU. He and I have got this great relationship. We've been in tune and in sync since 2011. So like he's the #1 doctor that I want as my chief medical officer. He comes on and we start making it happen. So we've just announced a new product that we've created with them called InCenter Care. So like think about incentivize, and basically it's an employer health program where everyone's incentivized to get healthy. And you're incentivized by your deductible inside the health plan. So you can get a way lower deductible from $3,000 to $500 if you hit certain markers on like glucose and cholesterol and whatever. So, you know, and it's working and it's awesome for employers. So InCenter Care, we're new health is the delivery mechanism. So, you know, let's just say with you, Doc, you're an MD. You can be in our provider organization. If we sign a massive employer on Hawaii, you know, on the island that you're on, for instance, it doesn't have to be because telemedicine in almost every state now allows you to do it. But let's say we signed a 20,000 person employer, right? Out of those 20,000, you know, everyone has now opportunity to use the health coach. Maybe 200 out of them, 1% would need the functional medicine doctor straight away. So we would partner with you and you would get paid $300 an hour to see those patients. And, you know, the employer's getting billed, but ultimately we're going to get people off drugs. We're going to get people better. And the long-term cost trajectory is no longer like this. It's now going down. Right. And that's what no one else has been able to do. Getting costs to go down, no one has done that. We are doing that right now. And that's what I'm talking about with the winning hand, right? That's what everyone wants that we're doing. So for employers, we've partnered with InCenter Care. And then the other thing that I mentioned before is insurance. And I'm really, really excited to be able to share that we're gonna take a stab at disrupting insurance, health insurance, this year. So it's not going to be insurance. It's going to be community cost-sharing cooperatives.
Awesome.
So we're going to have groups of 10,000 people that can come into their own health cost-sharing cooperative, can extricate themselves out of the system, and can be financially incentivized to be able to help their fellow man. If we're in the same cost sharing group, Andres, and you're on metformin because you've got type 2 diabetes, and I can help you get off by cooking you healthy food and taking you on my running club and, you know, doing a meditation stuff with you, I'm financially incentivized to help you to do that because we're all in the same pool. And this was not possible until January 2nd when Trump signed the bill, the tax bill, because now the tax penalty has gone away. And it's built on a technology called blockchain, which is the technology of Bitcoin. And you know that it's the key technology is a distributed ledger. And so imagine health insurance where everyone can see what everyone's doing. There's complete transparency. That is the vision of where we're going. And everyone in any one of those pools, the primary care layer that they have is our health coaches and our doctors. So we believe like the energy that I want, the reason why I called my company New with a K is because when you say it, I want people to say this is just the new way that things are going to get done. But the K at the beginning is like, hey, we always knew that community was the answer. That was the way we always did things for all of humanity. We've only got to, in the last 100 years, a state of separation where we thought that separating everyone else and sort of dominating disease and whatever was the plan. But ultimately, it's not a sustainable plan. You think in 10,000 years, you know, are people going to be doing heart bypass surgeries and, you know, Vicodin? No way. Like technology like meditation has survived for 10,000 years because it works and it's easy and, you know, it survives over time. So we're building the new medical system and we're taking employers and we're taking these groups into these health cost sharing cooperatives. And later this year, from June 24th until November, I'm getting in a bus with my wife and my daughter and my friend, and we're going to cruise around America, going city to city, sharing this new vision for American healthcare.
That is awesome, man. I'm so excited. So how are you going to ship the bus to Hawaii, man?
I don't know. I think we're just going to fly over there. I might be coming to Hawaii in the first week of June. So watch this space.
Awesome, man.
I've never been to Hawaii. I really want to go. I live in LA. It's so close. But I'm planning to come to Maui the first weekend in June. So watch this space.
Yeah, right on, man. A lot of exciting things here are happening right now. We just got Blue Zones, a specification for a hospital as the first work site in Hawaii to have Blue Zones specification. So we're really thrilled about that because it's that about community. I love what about community. I was just Dr. Marheimer, wasn't he the one that worked with that church?
Totally.
I mean, the data is amazing, and so tell us a little bit about how community and how you've came about this.
Yeah, look, through those stories, like through, Mark is a trailblazer. So through seeing that you could reduce healthcare costs, like the only truly inexhaustible resource that we have in medicine is community, right? We don't have unlimited doctors or health coaches or whatever. So if we can engage this peer-to-peer community support, that's how you reduce healthcare costs. And seeing as you brought up the Blue Zones, I want to just share my thoughts on that. So when Dan Buettner brought the Blue Zone thing back to America, they did an initial test in Minneapolis or Minnesota, somewhere in Minnesota. And they found that by adding community services and focusing on community rather than on healthcare, they were able to reduce healthcare costs by 40%. That's amazing. But who actually benefited from that reduction? Aetna or Blue Cross Blue Shield or someone. Not me and not you and not anyone living in Minnesota. So what I'm saying now is let's do that Blue Zone stuff, but let's actually incentivize the community to participate in it so that everyone is doing it and kick out the insurance. Because once you get past 10,000 people, you don't need insurance.
Right.
Insurance is playing no role apart from just siphoning most of the money into their pocket. Traditional insurance is 50% efficient, i.e. 50% of the money that you pay Aetna goes to pay claims. My thing that I'm proposing is 95% efficient. 95% of the money that you pay in goes to claims, and you can look on your panel at any time. So let's just say you're in a group of 10,000 and you have a car accident, and that car accident costs $10,000. You put in your claim, you get the $10,000 back, and everyone in the pool gets debited $1. And you can see it happening in real time. You can see the claims happening. You can see how many people are in the pool, how many total claims today, how much do you owe. It's going to be like a quarter of the cost of insurance. And the truth is, at this moment, it was the Trump tax bill that allowed this to happen, because up until he signed that bill, if you didn't have health insurance, you had to pay a penalty. But now that that's gone, game on.
That's awesome, man. And, with this is the time, with the blockchain where it is now, the technologies that are there to create that ledger to be decentralized and demonetized. And so that people can be a part of it, all this community. That's awesome, man. That's great.
This is basically the equivalent of Mark Hyman telling you about the Cleveland Clinic on my show. I'm doing it to you because I haven't really talked about this yet, and we're going to announce it on the Functional Forum on the 5th of March. So your crew are getting an early look into what we're doing, but I'm unbelievably excited about it. We've got the investors, who believe in the vision. We're connecting with massive groups of decentralized networks, like people like CrossFit, people like, the essential oil, multi-level marketing people, even people like, things like WeWork or whatever, like where there's decentralized groups, where there's not enough trust in the group itself to be able to say, hey, I trust you to make your health insurance and just go get them and we'll just pay in. But the distributed ledger creates that trust because everyone can see what everyone's doing, and everyone knows if this guy's ripping it off, we can kick him out of the group, and that. So I can't wait to see the way that people interact with a system that has complete transparency, because transparency is the opposite of what we have in medicine right now. We have privacy and no one can know. And the only way that you actually see what's happening in medicine is where you look at the records of Aetna or whatever that are making billions and billions of dollars. But, ultimately we're going to bring transparency, community, and empowerment into medicine in a big way this year.
Awesome, man. I'm just so looking forward to see everything that you're going to do this year. That sounds outstanding. And if we were watching a movie about your life, what would be one point in the movie that we would be like, oh, wow. What is one of those moments?
That's a good question. I hadn't thought about that. I think, there's a lot of points. I think, the most important point was where I realized that I couldn't be an investment banker like 12 years ago, 13 years ago, almost now. It was just really, I had a mentor who sat next to me and he didn't say this when he was sober. He said this at his leaving party when he was like totally hammered. And he said, look, I've been sitting at the same desk for 30 years. Go and do something interesting with your life. Like, don't do this. And, that really hit me. And I was like, oh, okay. Thanks, mentor. Maybe this is why we were meant to do it. And, just started off on that journey. So I would say that would be like a big moment. I think the biggest moments are still to come, right? We built the doctor network. Yeah. We've sort of got the attention and trust of the community by putting out this show for a long time. When we hit 1 million people inside the pools, that'll be amazing. Yeah. Our goal is to get to like a number of people by the end of this term of the presidency, by like November 2020. If we can have 10 million people in these pools, we will then have a shot. We'll have a seat at the table for all future healthcare negotiation. And that's our goal. And, ultimately, medicine is controlled by the payers and by the employers. And, the employers actually are the most interesting people in medicine because they have more incentive than anyone to cut the costs. Yeah. And the employers are super incentivized to cut costs. I'm not sure if it's very clear that insurance companies have that same incentive. So that's why we're excited to work with them and to see. So yeah, watch this space. If you're in Hawaii, maybe we'll do an event in Hawaii. But more than anything, we're going to come to the 40 biggest cities in America and we're going to share our vision. We're going to put the doctors who are in our doctor network on stage because ultimately, the doctors that have made it to functional integrated medicine thus far, something in their life has shown them something where they now feel a moral obligation to practice this type of medicine. We want to celebrate those doctors, but we also want to share a structure by which this could be delivered to the masses.
Awesome, man. Yeah, I completely agree. Something morally said, we can't do it another way. So awesome, everything what you're doing. Thank you so much for being with us, and people are going to love this show. Thank you for, trusting us to share. What an awesome announcement, and wish you all the best with everything, man.
Thanks, Doc. Yeah, check out newhealth.com. That's new with a K. If you go on now, we have a document that you can download, which is called 10 Ways to Save Money in the Current Healthcare System. And ultimately, the most important thing that you can do is to become an advocate for your own health, to not get a chronic disease that could be caused by lifestyle, to learn how to save money on everything. Your doctor is not your fiduciary. Yeah. You have to be your own fiduciary. And that's what I would leave for everyone.
Absolutely, man. Absolutely. Awesome. Great. Hey, thank you so much for doing this. Hey,